Good afternoon. Hope you had a good lunchtime together and ready for our presentation. Today we are joined by Jim Marshall. Jim is a 38-year educator who has a Bachelor of Science in Education, mainly counseling education. Jim has 8 years of experience as a speaker in partnership with Drug Free Youth and has done approximately 506 presentations. Jim was awarded Educator of the Year in 2014 and formed Codys Gift in 2011. Please join me in welcoming Jim.
Thank you, Barb. Appreciate the opportunity to talk to you today within this conference confine here. This is new for me, even though I've been speaking for approximately 9 years since I retired from my education gig. I've not done a virtual situation. It is odd to me, to say the least, but anytime we have the chance to talk a little bit about our youth, I'm not going to pass on it. I'm going to jump all over that. And today we want to talk about the scenarios that we have with our youth. The title of my topic here, or my speaking mechanism, is the struggle epidemic. I really believe we have in this scenario, and of course with COVID, we haven't helped the situation either, but we have the largest struggle we've ever had with our youth in the last century. We have more youth struggling with substance use issues. We have more youth that are struggling with mental health scenarios. We have more youth that are struggling with suicidal thoughts and suicide. It's overwhelming. And today what I want to do is tell you a little bit about where I came from background-wise and why I'm doing what I'm doing. And then I want to connect all three of those syndemic topics and explain how suicide, mental health issues, and how substance use scenarios are all intertwining with one another, and maybe what we've been missing or not doing correctly, and what we can do to try to improve these scenarios with our kids. The name of my not-for-profit is Codys Gift, and the name came from my son. I lost my son September 25th, 2011. In the midst of grieving over losing my son and trying to figure out why that happened, what I could have done better as a parent or an educator, started delving into the topics of substance use and mental health scenarios. Cody was as normal of a young man as you could potentially have. Didn't make sense. Didn't really understand it. So I started talking a little bit about what I learned from kids who came to me and talked about their issues, friends of my boy. I started researching the topic. I went to conferences. I went to workshops, took graduate classes. I spoke with people in recovery centers. And when you add that all up, it made me feel like I needed to share what I learned with other people. And not only was that a coping mechanism for me, because it allowed me to talk about my boy some more and allowed me to keep him in the front brain, but it also allowed me to help people understand maybe some of the sicknesses and some of the scenarios that they had. I speak generally at schools. 90 to 100 schools per year has been my menu. I haven't spoken a lot here the last 4 or 5 months. I'm hoping to get back to that. But today I'm going to share some of the stories of kids who come up and talk to me after this. Sometimes I spend an hour to an hour and a half talking to kids individually as they pour their stories and their hearts and their situations out to me that relate to the topics and relate to the subject matter. We all know there is stigma with mental health issues and stigma with substance use scenarios, and a lot of our kids don't really find it comfortable to share these stories with people that are school employees or with anybody, even within their family. So I didn't really understand when I started talking to kids that they would share their stories with me, but I feel like I provide a couch in my talk and a comfort zone, so to speak. Cody was 19 when he started using. It was right out of high school. Cody was working in factories at age 19, trying to figure out life like some of our lost kids do at 19, 20, 21. Not a lot to do for a 19-year-old in Jefferson City or central Missouri. So he worked all night, and then he came home and he slept a lot and worked all night again, and wasn't a very good life. A lot of his good friends were in college. Cody was grinding, trying to figure out what to do. And in the midst of being depressed and upset and kind of an anxiety young man to start off with, he started self-medicating. That term you'll probably hear a couple times today from me, self-medicating. A lot of our young people are self-medicating today for mental health scenarios. 1 out of 3 college kids take a prescription that's not prescribed to them. It's pretty common today. I really believe part of that has to do with the medical industry and big pharmaceutical companies. If you watch TV, you see tons of commercials every night on prescription pills and synthetic pills that can provide you with some type of solution to your problem. I don't know what we do about that, but I do know we're quick to remedy most of our issues with our kids in a pharmaceutical way. It's backed up in stats. I believe the biggest one that we have to use is that 90% of all painkillers that are made in the world is used in good old United States. We make up 5% of the world's population. We use 90% of the painkillers made. Either we have a monopoly on pain or a monopoly on medical issues in the greatest medical country in the world, or we're abusing painkillers, and I believe it's the latter. Cody got hooked to a higher level on prescription pills because of this fact. At the time that he was suffering, I took him to the doctor, a 20-minute talk with a nurse practitioner, and that 20-minute talk led to him being prescribed Zoloft, which is a medication for depression, and he wasn't required to go to any counseling, wasn't to see any psychologist, psychiatrist. Here's a bottle of pills, this will fix your problem. We do this quite often in America, and we misdiagnose a lot. Remember, when you diagnose depression or bipolar or anxiety or any of those conditions that deal with mental health scenarios, there are no MRIs to see that we have those types of things. It's a listen, here we go, and this is what we do. I could go on for a day talking about what we need to do in the medical field to change the situation. But to start off with, we really don't need family physicians and nurse practitioners openly prescribing benzoids and opioids when that's not their specialty. You wouldn't go to a bone doctor for a cancer issue. You wouldn't go to an oncologist for something non-related with a thyroid issue. This was a kicker in Cody's scenario, and I hope that we do more screening and more testing and counseling suggested situations. Cody moved on from the Xanax and Zoloft that he used and eventually moved to heroin. 80% of all heroin users started with a prescription pill addiction. A lot of people don't know that. I think there's a misnomer that a lot of young people out there just start taking fancy, heroin pills or fancy heroin situations, and that's where they start. Nobody starts with dynamite. They start with the firecrackers, and when they can't afford the firecrackers, they move to the dynamite. When my boy got basically put in the corner, I guess would be the best way to describe it, in the money resources he needed to buy his prescription pills, could no longer steal because that was out of the option since he got in trouble with the law. He moved to a source that was easy to get and cheaper at $5 a day, the heroin. sadly enough, this has a lot to do with the opioid epidemic, is the prescription pill epidemic that they start with. So uh, as we stand here and speak in Missouri, it's an interesting topic to talk about because we all know Missouri does not have a prescription monitoring program, and we are the only state in the United States that does not. So Cody moved on to heroin. 4 months after he moved to heroin, I came home one night, found him on the floor, overdosed, and we got him to the hospital, and he survived 3 days on a ventilator until we found out that he had no blood flow to his brainstem. So we lost Cody September 25th, 2011. He did have some mental health scenarios going on. I do not blame the choices that he made on the family physician scenario, but I do understand, where we're missing our connections at here. So with that being the explanation of how I got started and what happened to my son, let's talk a little bit about the three rings or syndemics: mental health, substance use, and suicide going on with our youth. And the first question I get asked by people my age, baby boomers or parents that are older parents, not younger parents so much, here's what I get asked: Coach, what's wrong with our kids today? Like we just all of a sudden started producing kids that had something wrong with them. Like they were all born with a birth defect. And really what the question needs to be rephrased or changed to is not what's wrong with our kids, it's what's wrong with our environment. None of these children are born with ADHD or born with a genetic predisposition to be an addict or wanting to commit suicide. They are environmentally influenced by what's going on around them, whether it's social media, which we all know has had some negative influence on our children, the cell phone. Did you know that depression has tripled since the cell phone came out? Did you know that suicide has tripled since the cell phone came out? Again, environmental factors that have contributed to mental health issues. 1 out of 7 kids that walks the street today has had a traumatizing event that on the adverse childhood experience score chart is a 7 or above. 1 out of 5 will suffer depression or have a post-traumatic stress disorder before the age of 18. 1 out of 5. Think about the size schools that we have today in our country and how many kids that would mean in a school of 1,000 kids. 1 out of 5. And we have 1 counselor in each school. Sometimes 2. But right now, the average counselor to student rate in our school district is 1 to 400 kids. So if we're talking about a 1,000-person school, and we have 50 to 100 kids that are severely traumatized, I'm saying, well, Coach, what type of trauma are we talking about? Well, we can't list all the traumas or sit here and talk about all the traumas. I'll tell you one that I had a child walk up at age 9 in elementary school I spoke at last year in Southwest Missouri. She came up and she said, Coach, can I talk to you? And there were about 10 kids waiting in line. And she kind of said, can we go over to the corner? So I kind of walked over to the corner to talk to her. And she said, when you talked about Cody kind of suffering, with some problems and issues and such, and he self-medicated with Xanax and the Zoloft, and then eventually hearing, she goes, I self-medicate. Helps me take away some of the pain. And I said, well, what are you talking about? What type of self-medication? And she said, well, I cut myself. And she showed me her arm, and she had 5 or 6 bad cuts on her arm. And I said, why do you do that? And she said, well, it washes away some of the pain. I feel clean. I feel better. And I said, the only way you're going to get better is to talk to people about this issue. See, we don't think of kids harming themselves physically as self-medication. I really believe that Self-medication is labeled to every one of those areas that I talked about: mental health, substance use, and suicide. Suicide is self-medication. I refer to it as a permanent self-medication for a temporary problem. So I tell our young people, don't take a permanent solution to a temporary problem. But we have tons of kids cutting themselves, thinking about suicide. The age group of 10 to 14 has tripled in suicide the last 10 years. 10 to 14. We have 10-year-olds looking for a rope. I never thought. I was an educator for 38 years in the schools. I would have never imagined that we had 10-year-olds looking for a rope. I would have never imagined that we had an average age of starting substance use at age 12. That is currently our substance use starting age for when we do interviews and we do research and we do studies and we study people that have been in recovery and we study people that have actually been through severe addiction. We find out the average age they started was 12 years of age. And we know that the brain of a 12-year-old is nowhere near full size yet. So when I tell kids about this average age, I'm like, what chance does your brain have to function properly or to stay functioning properly when you're using at age 12 with half a brain to use? We know that the brain does not finish developing till age 25. Here's a silver bullet in this. Studies show that if kids do not use or abuse substances until the age of 18, there's a 90% chance they'll never develop an addiction. My question to you and to educators and to schools and to people that work in these areas, how do we get kids to abstain until age 18? You know, that's $1 million question. I wish I had an answer to that, but I know that one thing we can do is educate our kids in these areas. The trauma, I hear people speak on mental trauma and its influence on our kids today. I had one workshop where the gentleman spoke on mental trauma and said, you have to understand that when you have a kid that's traumatized with post-traumatic stress disorder, they're a rear brain thinker. They don't use the front part of their brain to rationalize, to problem solve, to figure out an emotional focus on how to control their emotions. They're just like the veteran who drops when they hear a gunshot. They're reactionary. You touch them on the shoulder, they want to fight. You have a mean look at them, they want to fight. You have basically a kid that works on fight or flight. And we haven't figured out in education yet how to help these people through this trauma and through these mental health scenarios. So going back to the start, there's nothing wrong with our kids. It's what's wrong with their environment and what's wrong with their culture. We've got to learn to recognize when we have traumatized kids and figure out an environment that can provide them with the opportunity to recover. So that's what I believe in the mental health scenario we have to look at and consider when we're dealing with the syndemic of substance abuse, suicide, and mental health issues. So let's talk a little bit about the substance use category. Right now, our number one gateway in this country for kids getting started, it's not alcohol, it's prescription pills. You'll have people debate that, but I tell you time and time again when I talk to kids who have dealt with the opioid issue or family members or involved in it themselves, I continually hear the start was a prescription pill scenario in the opioid epidemic. Synthetic opioids are basically painkillers. Not Xanax, but Percocet, Vicodin, Oxycontin seem to be the popular ones with the kids today. It's changed our country. And I tell the kids when I speak to them, this is how your country has changed with substance abuse as a result of it being a self-medicator. First, we have 13 million children that are raised by their grandchildren because of the opioid epidemic, by their grandparents. Grandparents are now carrying a heavier burden than they ever have on raising children. Grandparents were not equipped to raise a second generation, but they're doing it because 13 million kids have family members that are parents that cannot operate and function. We have lost 2 years because of overdose deaths and because of substance abuse scenarios to the opioid epidemic. Our life expectancy has now gone down from 79 to 77 years of age. Neonatal opioid withdrawal syndrome. Maybe that's something you've heard of, maybe not. Every 15 minutes, a baby is born with opioid influence, with seizures, with shakes, and with terrible physical repercussions as a result. We haven't seen what the end result is 20 years down the road because the opioid epidemic hasn't been around that long. How many people in their adult agehood will be influenced by the fact that they were born with opioid influence and had neonatal circumstances as a result of that? Grandparents raising grandkids, kids being born with the opioid epidemic scenario on the back burner, the painkiller syndrome that we expect to be cured every time that we have something painful. We've got to try to move away from the pain pill or the opioid circumstances solving our problems. When it comes to the substance use issues, we can look at legalization, we can look at alcohol influence, we can look at potential situations with what should we do with the pharmacy industry. I think we need to educate kids the dangers of substance use when they're in elementary to middle school. I think we need coping skill classes to help our kids understand that the healthy way to cope is not to use medications to try to feel better. I really believe that substance use has increased because that has become the number one coping skill of a lot of kids that are damaged kids. Really feel like we've got to find some way to educate our kids and ways to put them in a better scenario. The war on drugs has been a part of the substance use scenario for 40 years now. We have found out the war on drugs has only made substance use and mental health issues worse. We have drug courts, which I'm all for, helping people recover and getting their lives back on track. But we've got to address the mental health needs of everybody that goes in with an addiction to an incarceration situation. Right now in America, when somebody goes into incarceration with a mental health scenario and with an addiction issue, they are 3 times more likely to use when they get out of jail than they were when they went in. Now, if that isn't the worst result you could possibly hope for in trying to rid ourselves of the drugs in the streets and our kids using drugs or getting recovered, that what we're doing with them causes them to go out and use 3 times more than when they went in, I don't know what is. Why does that happen? 60% of all people that go into an incarceration situation with a substance use issue have a mental health issue. So when we work on their recovery and we work on drying them out, and we do not attempt to work on the mental health issue, then we end up missing one of the tires that were flat when they went in. So we fix the recovery and we fix the rehab and the substance use issue tire, but we still have a flat tire of depression or anxiety or bipolar or whatever the scenario is. And because of that mental health scenario, it contributes to them using again. So we've got to work on the criminal justice system of the substance use scenario as well also. I did mention coping skills. What are we doing at home? What are we doing as we raise our kids? I really believe, being an educator of 38 years, when it comes to coping skills, we haven't done a good job. Matter of fact, we've kind of gone backwards on teaching kids coping skills. And when I say backwards, it's because we've made things easier. You know, when you lessen the requirements it takes, you know, and degrees of difficulty to obtain a certain goal, you fail to push kids out of their comfort zone. You fail to push kids to a high standard. You fail to push them to accountability levels. And as far as this problem with coping skills lacking with kids, I really feel like we have become lawnmower parents. And I don't know if that's a term you've heard of, but it's kind of replaced the old term that we used in schools called helicopter parents. When mom and dad swooped down to protect Johnny when he got in trouble and tried to shelter him from consequences from poor choices, they reduced the consequences or actually got them out of that area. Well, lawnmower parents do the same thing. They just mow the obstacles down before Johnny hits that spot. So we don't put Johnny in an AP class because we don't want Johnny to get a B instead of an A. Maybe as educators, we don't want the failure rate to continue to increase, so we lessen the standards so kids don't fail. We all remember No Child Left Behind, right? We talk about everybody gets a medal. We talk about the bubble we put around them, protect them. I don't blame parents for doing this because it's a harsh world out there. And there are things we can't do that we did 30 years ago. But one thing we can do is we can push our kids out of the comfort zone real often. And we can make them do things they don't like and things that make them squirm. We can push them to a different level. And we can force them to do things they're uncomfortable with. We've got to get back to making life a little difficult once in a while for our kids. It's okay. It's healthy. Our kids learn to cope when they learn how to fail. So kids, adults, whatever age group we're talking about, we all learn how to cope through failure and through unfairness situations. We can't make our lives of our kids fair all the time. We can't fight for unfair circumstances all the time. I think a lot of our Gen Y and Gen Z kids think that life should be fair every single minute of the day that they operate. And when it's not fair, or when they do fail for that first time at age 20 in college, or they find life to be difficult, and they want to fall back on those experiences where they only succeeded, they're struggling because they do not have a toolkit that has any healthy coping skills. What they'll easily do is use a Xanax or use an Ativan or use an Oxycontin to deal with that circumstance. Why? Because it's easier than telling somebody your problems. It's either easier than discussing things that you may be made fun of or you may be labeled or stigmatized. I mean, it's simple to understand why people don't ask for help when it comes to depression, right? Or anxiety, or never ask for help when they realize they have a severe addiction issue, because we're going to be labeled, we're going to be judged, we're going to be stigmatized. It's much easier to take a pill, much easier to smoke a substance, and it's much easier to drink to reduce those issues than it is to confront them. And we've got to teach kids that that is not your first go-to when it comes to coping. We've got to teach them to do that. Teach them that exercise is a healthy coping mechanism. If I was a superintendent of Missouri, I'd make sure all age groups had 2 or 3 recesses of 15, 20 minutes. Our kids can't sit in class for 6 hours straight. They never could 30 years ago either. But now, because we have these curriculums and we have these certain scenarios, we want to make sure these kids get all the education they can. But they've got to be able to use energy to cope. They've got to be able to exercise. They've got to learn how to emotionally control themselves. And they've got to learn how to problem solve. And those are all part of learning how to cope with life in a serious way. I mean, have you heard that currently our quitting rate and our grit rate with our youth is as low as it's ever been? Even at West Point, all those phenomenal cadets that go up there, They have a high quitting rate. After that was their entire dream in high school and middle school was to become a cadet. Our grit factor is low right now. We've got to develop more grit situations for our kids. And we've got to let them fail more, but we've got to work on teaching them how to cope. It's an important part. You'll find out that most people that were successful, it's not because they were the smartest people in the room. It's not because they were the top ACT score. They were people who knew how to fail, knew how to get up, and knew how to respond to difficult situations and didn't run away from them. So that's an important part. And I tell parents when I get to talk to parent groups, sit down with your kids, talk about how do we cope in a healthy way, what's an unhealthy way to cope. Talk about the substances out there and self-medication and what self-medication means. Encourage them to speak, communicate. Communication is not this. See, this is another factor. Our kids think this is how you communicate nowadays. They spend an average of 8 hours a day on this thing right now. And all it's doing is increasing some of the mental health scenarios we have, and it's increasing the depression and increasing the anxiety that we have. I tell kids, do not base your self-worth off of what you read off of a phone. Do not base your self-esteem off that. Get outside, do things that you enjoy. So maybe we have to get back to actually talking about what is healthy coping. Play music, do something that you enjoy doing when you get in a bad place, and by all means, talk to people when you have problems too. We're not talking. It's as if we have become a mute society and we have substituted the phone or social media or other operations for our communicating now. With some of the kids that I've talked with, you would be amazed at how many kids this is happening to. Down at School of the Osage last year, I had 5 kids come up to me out of the 40 that waited in line, and they all said they had tried to commit suicide in between 10 to 12. I had a young man in North Carolina come up to me and said, Coach, he goes, I have a friend that self-medicates. He said, I actually told his parents he was using opioids to self-medicate some of his sadness and frustration. I said, well, are you still friends with him since you kind of literally threw him under the bus? He said, no, we're not friends. He got mad at me because I talked to my parents. I said, so you actually threw yourself under the bus in your friendship to help your friend out? He said, yes, I did. And I said, well, we need more young people like you. We need more people that are willing when their friends are doing doing things that are considered poor choices and poor scenarios. We've got to have them speak up and help their friends out. I told you the story of my son in regards to losing him. I have 3 other stories, and I'll share them kind of in short here because I know I'm probably running towards the end of my time frame. Christina was a 2008 Jeff City graduate that I coached here in Jeff City. Christina was our class valedictorian. She had a 34 ACT. Now, when I go around, I ask kids to raise their hand if they have a 34. I've had 5 kids in 9 years in over 500 schools raise their hands. So she's pretty special academically. She was special behaviorally too. A leader, a great kid, friend to all, happy. I never thought that Christina had anxiety or any type of scenario because she was just a happy-go-lucky kid. Christina went up to Mizzou. Of course, Christina, being a very high achiever, wanted to be number 1 in her class, and in 3 years, she graduated from a 5-year program. Yeah, 3 years, graduated in 5 years. Magna cum laude, and she went into her master's program, and it got tougher. And Christina started using some Xanax on the suggestion of some of her medical friends that were in the medical field up at Mizzou too. Christina gradually moved to higher powered benzoids and also included some opioids. Christina moved to heroin, and in 2012 her parents found her non-responsive on her apartment floor, 6 months away from becoming doctor. Christina self-medicated because of the stress, because of the pressure. Of course, it was easier to do it that way rather than talk to somebody. It was the common trend. They found 19 other friends of hers were doing the same thing that were med students up there. Remember, I told you 1 out of 3 college students takes a prescription pill not prescribed to them. You want to know what the number 1 pill is? It's Adderall. They use that as an amphetamine to stay up all night for exams. ADHD, boy, hasn't that been a phenomenal label we've thrown out there in education? The kid that can't sit still in the seat, the kid that's fidgety, the kid that has talking issues, the kid that has behavioral issues. He's an automatic ADHD, right? What if that kid was the kid that was cutting, who had, and I didn't tell you the whole story on that, but I'll share that with you. She told me she cut because of what grandpa did to her at age 5. So let's say that's the kid who's the fidgety kid and the kid that's rear brain triggered. We send them into a family physician and we say, you have ADHD, and we put a PTSD kid on Adderall and Ritalin. Do you think that medication lines up with that kid's problem? If that kid stays triggered on long enough because of their problems, they're going to crash, aren't they? That kid will eventually be a crashed, non-triggered kid that can't get up in the morning, can't do anything, and sleeps all day in class. So we take him now back to the doctor and we say, well, this kid's not hyper anymore. This kid's kind of gone downhill. This kid's non-responsive. That's what I thought Cody was. He was laying in bed all day long. So I thought he's depressed. So we take him to the doctor, and we take any kid like that to the doctor, and they're given depression medication when the issue is they've been triggered on too long for PTSD. Again, depression medicine doesn't work for PTSD. Let's say we get to the phase where the kids kind of one day they're up, one day they're down, one day they're up, one day they're down. You know what diagnosis they're going to get there, don't you? Bipolar, right? Again, PTSD and bipolar are not the same things. We can't medicate PTSD with bipolar medication. This is happening a lot. The next 2 people that I dedicate my talks to, Jessica was a runner of mine who went to Missouri S&T. Jessica was a full ride scholarship distance runner at Missouri S&T. Jessica had a car accident, which they put opioids on her plate because of the pain she had to her back. Unbeknownst to that group that put her on the opioids, her family doctor, that she was also on anti-anxiety medication, some benzoids for an abusive boyfriend. Again, trauma, adverse experience. So here she was taking opioids for her back issue and taking benzoids for her anxiety issue. She developed a dependency on them and later an addiction that she fought off and on for about 10 years, eventually moved to heroin, went to rehab several times, seemed to be clean several times. 2 years ago, we buried Jessica because she died of a heroin addiction. Again, a combination of mental and physical pain that she developed a physical dependency and mental dependency on. The last young man, Taylor, was a friend of my daughter. Taylor started suffering from depression at age 12. Now, remember I said that the average starting age for substance use is 12. Taylor started using substances at 12. Mom tried to move him to a private school. Mom tried to bring him to different circumstances. Counseling-wise, she was a head counselor, so she did everything she could do. Took him to doctors. He was on all types of medication for his depression, but Taylor ended up becoming dependent on opioids and developing a heroin addiction. Remember, I said 80% of all heroin users start with a prescription pill scenario. Taylor went in and out of rehab 5 or 6 times, according to his mom. Taylor, at age 28, 16 years after taking his journey down depression and parents doing everything they could. He woke up from an overdose in Callaway County and he shot himself in the head. Taylor was self-medicating for 16 years. Taylor decided to permanently self-medicate, being distraught at the fact that he was living a life that he was not happy with. And, quite frankly, when I talk about overdose deaths, because that's how my son died, and by the way, we do have someone die every 8 minutes. I've been speaking for about 45 or 50 minutes, so we've lost probably 7 people while I'm speaking. This is the number one accidental death in this country. We have 30 million people in the world that die of overdose deaths. We have 800,000 people in the world that die of suicide. I know we're all sick of the pandemic called COVID. COVID's not taken nearly the number of people that suicide, substance use, and mental health issues are. Every year, we lose about 200 million people to one of those three. And we call it an epidemic, which means it's only a problem in a certain part of the country or a region. Pandemic means the whole world is affected. Well, the whole world's been affected by this substance use problem. It's been affected by suicide and been affected by mental health issues for as long as human beings have been alive, but we can't call it a pandemic. We've got to acknowledge that this is what I'm talking about is 10 times more dangerous than what COVID could be or is. I wish we would give it the recognition it needs, and I wish we would spend more time talking about it in schools. I've offered to talk to educational departments in states. We continually talk about what we need to do with our damaged kids, but we do very little once we get past the talking points. I talked to a superintendent 2 years ago. I said, "You guys have driver's ed in your curriculum?" And he said, "We sure do." And I said, "Why do you have driver's ed?" He said, "Coach, that's an easy one. We have driver's ed because we want our kids to be safe drivers when they get out on the road." So I said, "In essence, you're saving lives, right?" He said, "Well, of course, that's probably a long-range goal, but yeah, safe drivers, saving lives, one and the same thing to me." And I said, "Well, what are you doing in your middle school to deal with substance use education or knowledge or prevention? What are you doing, with the mental health issues and trauma that we have kids? Are you increasing the number of counselors? Are you increasing the number of behavioral interventionists? What are we doing to help the 1 in 7 kids that are traumatized and the 1 in 3 kids that have a family that's full of addiction? What are we doing with that? We have classes. Do we have it written in our curriculum? Sure we do, Coach. Pull out the health curriculum. We got one chapter that we cover each year in freshman health and 7th grade health in middle school that talks about substance use coping skills. We bring the drug-free youth group in here, and they do their skits and they do their talks about substance use. Sometimes if we have our law enforcement people available, we do the DARE programs. That adds up to about 8 days from age 12 to age 18 on substance use coping skills and mental health scenarios. We can do a better job than that. We have to do a better job on that. As I told that superintendent when I finished my talk, that Missouri Assessment Program score, that curriculum that my boy went through in Jeff City High School, and what he learned in middle school isn't helping him much right now out of Resurrection Cemetery, nor the other 6 families who I know out there that have their kids buried out there that died of an overdose too. Primarily, that one person who dies every 8 minutes in this country is a kid. 42,000 people will die this year of an overdose. We don't know how many of those overdoses are suicides, because once they inject that needle or they take that heroin, we don't know whether their intention was to die. That's not on the coroner's report. We just see what's in their bloodstream. I really believe that a lot of our overdoses are what I call involuntary suicide. That means they didn't really try to die, but they didn't care either. So I want to thank you guys for giving me the opportunity to tell Cody's story, and Christina and Jessica and Taylor. I hope that it opens up eyes to the traumatizing scenarios that our kids are going through. No, not every kid takes a pill because they're traumatized, but I think we need to understand that there's more trauma that goes into our kids using substances than we realize. And we have to make sure that we're doing something to teach them how dangerous that road is and what other roads can they take to cope with the problems that they have now. And I know a lot of you my age are saying, you make it sound like our kids have it 10 times tougher than we did, Coach. They don't walk 2 miles to school in the snow. Matter of fact, they get snow days on 1 inch today, don't they? I'm not talking about that. I'm talking about what their environment does to them, how tough their environment is, and what they have to go through today with the family environment and the situations they're in, the cultures that they're in. They do have it tougher. They do have it a lot more rough. Bullying in my day, you had a bully who you dealt with maybe walking home from school, and you had to either stand up to him or run. But it was over when I got home, whether I was in a fight or whether it was a situation that I ran quick enough to get away. Bullying's never over now. That cell phone and the social media allows bullying to bully that kid 24/7. And I know most of you don't let your kids walk to elementary school and kindergarten anymore because of what's out there. They live in a sick culture. Our culture is much sicker, and it's got a lot of people who, are out in the world that are dangerous people. So I think we need to understand that our kids face dangers. There's a good reason for them to be traumatized. You know how many school shootings we had when I was in school? 0. Now we average a school shooting every week in this country. Can you imagine the trauma of going back to school after you lost schoolmates in a school shooting? I can't imagine how they help these kids recover. I can't imagine how they keep them from dropping to the ground every time they hear a loud sound. It's a tougher world. It's a harsh world, and our kids need to be helped and walk through it. But again, do not bubble your kid in a comfort zone. You got to push them, you got to drive them, and you've got to help them experience some failure and learn how to deal with that failure. I'll take some questions now. Again, hope the awkwardness has been kind of excusable. This virtual stuff has put a low-tech guy in a high-tech world, and it's been interesting to say the least doing this right now. So I'll look at some of the questions and see. I see a comment that says school shooting so sad. I agree. Yeah, that's horrible. Any other questions? I see some thank yous on there. I appreciate that. When I started doing this, I cried a lot. When you do something for 9 years, you got to get a little bit less emotional, and you kind of hide your emotions in your sleeve. But it's not fun. The first line I talk to the kids when I'm at schools is like, I don't do this for entertainment. Matter of fact, this is like taking a knife to your gut. I'm watching your guts roll out on the floor, and tell everybody that's a stranger to you in this crowd, I'm sad, it hurts, and I'm mad. And it's hard to do, but it's cathartic, because when you have these children come up and tell their stories, they've walked out of that closet for the first time, and they know that they're not the freak show that they thought they were. This happens to a lot of people. And because of the stigma, I think my talks help kids figure out, that their parents weren't bad people. They suffered a disease. And, it's a disease that's hard to beat. And maybe that's why I continue to do it, because the kids tend to see this as something that explains something they don't understand. See another question. How are you doing now? Well, I have good days and bad days. Cody passed away September 25th. That's going to be a hard day in a couple weeks. When you walked into your household and you found your boy laying with no respiration, no breath, and did CPR on him and watched him hooked up to tubes for 3 days, that period of time gets tough. I'll tell you, I didn't do well for a long time, and this is part of why I did what I did too. I'll tell you, the first couple of months I went to my job. I was coaching in college level at Westminster and William Woods at that time. And I came home every day and I stared at the ceiling all night long. I wasn't coping very well. This is my coping mechanism. It doesn't make things necessarily better, but it helps. I tell kids, I'm self-medicating when I do this. This is my heroin. This is my meth. This is how I cope. This is how I survive. If I can do this with what I experienced, you can do the same thing. And being a coach and educator, it fits right up my alley because for 38 years I told kids you take negatives and you make positives out of them. And when you do that, you make yourself better and you make other people better. And probably the best coping skill I left out when I talk to you guys is giving to other people. When you give and you help other people, you learn to cope well. So I hope that that's your approach to life too, is that whenever you help, you get better too. What way can we educate the doctors and counselors who prescribe medication that is addicted to people who are misdiagnosed? Great question. When I get parents that ask me, what do you do? I want to take my kid to get some help. There's nothing wrong with taking them to a family doctor, but I would also take them as you would if your kid had cancer to get a second diagnosis and second opinion. Take them to a specialist, take them to a psychiatrist, a psychologist, a counselor to go along with our family doctors. I'd be totally okay with our family physicians prescribing these benzoids and these opioids if they required these young people to go to counselors and go to psychiatrists to get their medication, because that's how we heal people, is to get counseling and to get therapy, not just to give them medication. So if you have people in your family struggling with it, get second opinions, get specialist opinions. Like I said, treat it like it's cancer, because you know what? A lot of people are dying from it. It is dangerous. It is deadly. So please get more than one opinion and get more help than you think just your family doctor can give you. What advice would you give to someone who has to wear a mask during COVID, especially with a disability? I can't be touching my face. COVID's provided us a whole different level of anxiety, hasn't it? Boy, that's a tough one. I would say, maybe you need a physical exception for your scenario there from a doctor. I know that some people are working with people that have those issues. My granddaughter has allergies and asthma, and she says all it's done is made her snotty and coughing. She goes, I think people think I have COVID because I'm coughing, snotting, snorting all day long. I really feel for people that have trouble. I don't have any allergies or any issues, and they drive me nuts, and I don't have any problems. What to do if you've done everything and they just don't want to listen? Well, I don't have a magic bullet for that one. I just say you never give up. To the day my son died, I tried to get him into rehab. I tried to get him into circumstances that would make him healthier. Tried to do everything I could potentially do. This decision still comes down to that person to wanting to get help and admitting they have a problem. When they get to be 19, 20, you don't have any legal control over them. They can leave the house. They can do whatever they want. All I can tell anybody who deals with this issue is never give up, because people do recover and people do get better, and they're getting better at it every day with the recovery scenarios and the harm reduction situations that we have going on. Let's see. Any other questions? And I appreciate all the people who said sorry for your loss. I hope that my loss is somebody's gain here. That's what we hope, is that some people learned a few things. You know, the most important thing I think we can take from all the things that you've learned, and I've seen some of the topics and I've watched some of them, is share this information and have dialogue with your loved ones and with your family. Uh, don't hold this knowledge you have now within yourself. I almost feel guilty if I'm not out to schools right now, and I don't get to because of COVID, that I'm not sharing information I have that may help somebody make a proper decision or a proper choice or not go down that road. Please don't hold this information. Let's have dialogue. I tell the kids when I talk to them, I want you to go home and share what you heard today with mom and dad, and then you guys have dialogue at home. Remember, dialogue is not you lecturing your kid. Dialogue is talking and then listening, talking, then listening, then listen to them. And maybe even more today, it's more listening than it is talking. But please have that dialogue with your grandkids and your family members. And please listen and give them the knowledge that you have. And for goodness sake, when people struggle, don't give up on them, no matter how bad the situation is. And I went through the hurricane too. You know, I went home and saw TVs missing and credit cards missing and cars missing and keys missing. And it can get bad, and it does get bad. But I've heard so many wonderful recovery stories. I just have to encourage you guys to hang in there when you're dealing with people who have these situations. I just had a woman who said that they've recovered and that's why they haven't give up. God bless you. I tell everybody when it comes to the drugs that we have out there today, if you've recovered from something, you have been given a second lease on life. And I don't know what your spirituality is. I'm a spiritual person. I'll say you are a miracle and you need to share that miracle with other people. So God bless you. And I hope that you share your story with other people who are struggling so that they have faith and they have hope that they can actually recover themselves. God bless you. Okay, another comment. My cousin, who I was very close to, took his life January 22nd, 2018. We've had 5 kids in Jefferson City in the last 4 months that have committed suicide. You know, it's becoming pretty common. I think the kids kind of expect, and they're not shocked when they hear that people are taking their lives their age anymore. It's become that common of a situation. Thank you, Jeff, on your compliment on the presentation. I'm not a scientist. I'm not a doctor. I don't have all the cool letters behind my name. You know, as you probably heard from a lot of those, I'm more of a tell it like it is guy. And if you know something, try and relate it to what people are living in today and not just give them straight up facts. I'm not a DARE program guy. I don't know whether DARE helped or not. You know, it wasn't around when I was young, and it's gone now. You know, I know it had good intent, but I don't think you can give kids just facts and say don't use and don't do drugs. I think you have to give them information, be straight up with them, and you have to be sincere with them too, to get them to listen to you nowadays. All right. Any other questions? All right. Well, thank you, guys. It's a strange world we're living in. Thanks for standing here and listening to this old guy. I appreciate it.
Wow, that I can say is wow. Thank you so much, Jim, for being here today and for presenting to the crowd. I know that they enjoyed it as much as I did. And I mean, I learned a lot. And I am super grateful that you came here today and we were able to make this happen.